A new report is highlighting the inadequacies of funding for aged care. Consulting firm Deloitte says there needs to be a complete rethink to attract investors into the sector. There are growing concerns about meeting future demand, with statistics showing the number of people over the age of 70 will almost triple in the next 40 years. Here's Andrew Robertson.
It's well documented that Australia's population is ageing. With that ageing comes the massive challenge of providing adequate care for millions of extra people who are not just older but living a lot longer. And the aged care system is already struggling to cope.
One of the key issues for aged care is the low returns on aged care facilities at the moment. Our margins are very low.
Which means aged care facilities are not being built at a rate which will provide for Australia's future needs. About 9% of the population is aged 70 or over, which is about 2 million people. This is expected to rise to 20% in the next 40 years, or about 5.7 million people. By the middle of the century, 10% of the population could be over 80. At the moment, it's 4%. That's predicted to see government spending on aged care triple as a proportion of total revenue to 9%, but by 2050, there'll only be 6 people of working age for everyone over 80, down from the current 16. Access Economics health economist Dr. Henry Cutler believes over-regulation is one of the key factors stifling investment in aged care.
There are price controls on the amount of money that they can charge to individual residents. There's regulation on the number of places that the government will subsidise at any one time, in particular regions as well.
One of the big aims of regulation in aged care is to provide a standardised service across the country. Dr. Cutler says that thinking is now outdated.
Investment needs to be encouraged by allowing providers to differentiate their products through offering different types of services in aged care. The government needs to stop cross-subsidising or creating a market where there's cross-subsidisation from low care to high care individuals as well, and match up the costs of care to services provided.
Derek McMillan is at the coalface as Head of Retirement Living Services for Australian Unity and knows only too well the struggles faced by those trying to make an adequate return in aged care.
The industry is really bleeding with chronic underfunding, where residents are unable to contribute to the additional cost of the care that's required in order for operators to actually break even, let alone make an adequate return on their investment.
Derek McMillan says the statistics around the aged care industry are an indication of how unappealing the sector is to private investors.
In 2005, a number of beds were allocated by the federal government to operators. Only half of those beds at this stage have been built. That's a very strong indication that there is not the adequate incentive to construct new facilities.
Mr McMillan says removing both the GST on the construction of aged care facilities and the Centrelink implications for older people who sell their homes would make investment much more attractive. Deloitte's Helen Hamilton-James thinks other incentives such as negative gearing would boost returns, and in terms of availability of capital, she thinks superannuation funds should be encouraged to look at aged care as a class of infrastructure investment.
Set aside a percentage of the superannuation pools to fund into aged care, so whatever the percentage is, it would be low risk or lower risk, obviously slightly lower returns, but a long-term aim to increase the levels of funding into residential aged care.
The Productivity Commission is conducting a detailed study of the aged care sector and has received more than 400 submissions. Those involved in aged care are hoping the Commission's report, due out later this year, will offer lasting solutions to one of the biggest problems Australia is facing.